My name's Pierre Côté. I've been practicing medicine in Montreal since 1988 at La Clinique du Quartier Latin, essentially treating people living with HIV.
Hello, my name is Louis Saint-Amand and I live in Montreal. I've had HIV for 16 years now and I'm 66. I have no intention of dying, so I hope you'll listen to a bit of this and let it motivate you to fight and figure out how to live a good, happy life, even with this nasty disease.
When
we talk about older people living with HIV, we're referring to those that are 50 years old and up. It doesn't seem that it's that high, but that's the reference. We have two kinds of patients, those who've been in treatment for several years already. They're very experienced and used to taking meds. And there are also the people who are infected at a much older age. Younger patients have stronger immune systems and have more of a reserve. But as people get older, this diminishes over time. So it's quite certain that starting treatment with someone who is 60 years old, rebuilding the immune system will not be as effective. Often we're going to have to use more aggressive treatment to treat older patients than someone who is only 20 years old, for example.
At a certain point, it didn't seem to have anything to do with HIV. Just old age, a chaotic lifestyle, a lack of exercise. And I was also suffering from severe pain in my elbows. And then finally, one day, I thought, maybe it's time to see a cardiologist. So the doctor makes me sit there in the waiting room for half an hour. You see, I'm not a very patient person, so I got up and said to the receptionist, "You've got to tell him to give my results to the other doctor's secretary." And she said, "No, he wants to see you. He wants to see you." As a matter of fact, he found a bed for me at the hospital the very same day. It hit me hard, and I really got the blues. So I said, "That's absolutely out of the question. There's no way I'm going to the hospital this afternoon. You can't do anything for my heart. I'm going to die of anxiety." So, 2 weeks later, I checked into the hospital thinking they were going to put in an aortic pump to unblock my arteries. I stupidly signed all of the papers, and the next day, there I was in surgery, having a coronary bypass operation. They kept me in the hospital for the next 30 days, and now I'm here to tell you that I came out of it alive.
One of the problems with growing old is that people could have other health problems, heart trouble, higher risk of cancer, neurological problems, osteoporosis, and a higher chance of hormonal problems. In fact, I would say that when someone is infected with HIV, the body ages more rapidly. HIV spreads throughout the entire body, and this is why, in the end, there is a higher risk of heart attacks and strokes. We try to explain the risks and all that these complications can get even worse if you wait too long to treat the problem, since it attacks and weakens the immune system. The earlier the treatment, the more beneficial it is. You have to take into account there could be side effects and adverse reactions to the treatment. We also know there are other factors that are quite easy to deal with and change. It's well known that many HIV-positive people are heavy smokers and tend to smoke more than the average person. This is one factor that can be changed. In fact, it's a significant risk factor in a variety of health problems. Nutrition is also very important, so is physical exercise. They've both proven to be beneficial in terms of lowering overall health risks. Maintaining a healthy weight, staying in good shape and good health, in fact, the best possible physical fitness, these are very important for quality of life. One phenomenon that we have seen physiologically is a decrease in testosterone in men, that is, the male hormone. There are many cases where HIV can lead to reduced levels of testosterone in the blood. We often see symptoms in patients like fatigue, weight loss, depression, lower libido, and other problems.
On peut voir chez une personne des symptômes de fatigue, de perte de poids, de dépression, une diminution de la libido, des troubles.
I'm going to tell you that despite your exasperation and frustration, which is perfectly normal, just tell yourself one thing. You're lucky. You're really lucky. Because you just happened to get sick at a good time, when there is really good medical treatment out there and you can get proper care. People don't die anymore of this, but you can die of social pressure. Sure, if you're already worrying about how you're going to feel in 3 months, or in 6 years, or how your grandmother is going to react when she finds out, that's just too much. Take it one step at a time, one day at a time. Breathe. If you have a good doctor, listen to what your doctor says. If you don't have a good doctor, try to get a new one. And take your meds seriously. It doesn't have to be dramatic, but you must take it seriously.
Plus la maladie avance et plus les gens vieillissent et sont à risque de développer des problèmes de santé, c'est l'ostéoporose, qui est une diminution de la densité au niveau des os. Ça n'arrive pas chez tout le monde.
As the illness advances and patients grow older, there is a much greater risk of developing other health problems. Osteoporosis, for example, which results in a loss of bone density. It doesn't happen to everyone, but as people get older, the risk does increase. There is also a much higher risk of getting different types of cancer, so we test for those as well. Whether it's lymphoma, for example, or lung cancer, we see more uterine cancer in women and more anus cancer in men, often related to the human papillomavirus, which gives people genital warts. We tend to test for it more often in women, obviously. We can imagine that someone in good health, so to speak, has a life expectancy comparable to someone living with HIV. Not only are people likely to live as long as someone who is not HIV positive, they can often live an even higher quality of life, comparatively speaking. With the medical treatment available these days in terms of having to deal with side effects and adverse reactions than they could, say, 15 years ago. Obviously, as people get older, the kidneys don't function as well, nor does the liver. Somewhere around 80 to 90% of older people take some kind of medication for other health conditions like high blood pressure, heart trouble, and all sorts of other problems. So we have to pay close attention and make sure their meds don't contraindicate, and we also have to consider the patient's ability to metabolize the medication and eliminate toxins. Often we can find a treatment that will avoid conflicting with their other medication to eliminate side effects and adverse reactions. Some scientists say that the HIV-positive people they have treated for a long time could actually receive such good care and medical testing and follow-up that in the end, they are in better health than some people who may not necessarily be aware of all the health risks they have incurred.
Qui ne savent pas nécessairement tous les risques qui encourent.
I have a health affliction, but that doesn't make me sicker in the sense that I have to overreact and make a big fuss about it. You have to take the drama out of these kinds of situations. You can't take it too lightly either, but at the same time, it's quite important that you don't feel guilty or ashamed of your condition. I've never seen anyone who was ashamed of having lung cancer.